our next speaker can tell you what to eat and how to eat it. So that's a good thing. We talked a little bit at lunchtime. I said, you know, we had a program one time, and Dr. Lou, if he's out there hearing, he'll remember. We were in, we were actually here, and we did a program for Lungnoids. The dietitian spoke in the morning. She said, you should never eat processed meat. You shouldn't eat the bread that is served all over the place. Salads are no good. This is no good. And guess what we served at lunch? And it was literally a mutiny. And it was like, I have nothing else that you could eat. But nowadays, the dietitians speak after lunch. So anyway, that being said, Leanne Burns has worked with a group which Dr. Anthony was in and knows nets. So I have complete confidence in her. She'll probably give me a smack afterwards, but that's okay. But please welcome her.
Thank y'all. Thank you so much. Yes, it's best that I speak after lunch. But after the lunch y'all had, if you need to leave the room and come back, you're not going to bother me. And I really mean that on a serious note, that I'm used to people coming and going, so you're not going to interrupt me if you do have to come in and out during the presentation. So we're going to see what the best diet is. I'm going to go through some illustrations today for you and speak mainly on things that will apply mainly for you. There are some great resources as far as the disclosure. I didn't put a disclosure slide up. I should have. But I have worked with every group that's out there basically in the foyer on recipe development. There's some books that we've put out through the different companies and information so that neuroendocrine patients could get things that really applied for them. And so do take the time to pick up the recipes and get information on the books. Those things will help you as you determine things that you can eat, or at least give you ingredients that are good, and you can kind of change them around, make your own thing with it. So what is the best diet? Well, the best diet for a neuroendocrine patient is one that contains the food and the fluids with a nutritional value which your body can tolerate and absorb. And as you know, that not all the foods that you consume your body's tolerating. No, I did this backwards too. Let's see if I can get this right. This is my hand right. Okay. So this is the guidelines from the USDA on how the plate choices should be, and we try to keep it fairly close when we're doing meal development for patients with carcinoid as well as cancer patients. But remember, other dietitians that you may go to do not know much about neuroendocrine tumors, and they may try to put you on things just like what he was saying that may not apply to you. So just remember that all this has to be modified. Nutritional needs when we're doing meal plans, this is about what we're trying to aim for as far as calories and protein, just so you'll know a little bit about what we do to try to get an idea of what you need if you go see a dietitian. We also determine how much protein you need, and most patients that have cancer or going through cancer treatment need a little extra protein in their day. If you increase protein, you have to increase fluid. Fluid is hard to absorb sometimes, so you do it in small amounts throughout the day. If you have diarrhea, separate your fluids 30 minutes before you eat or 30 minutes to an hour after you eat. Only sips to get down your food while you're eating, and this will reduce the transit time. In other words, it reduces your diarrhea. It reduces the time that stool goes through you. So when we're also looking at things, we want to look at your basic history. Everybody has different diseases, right? Some of you may be diabetic, some of you may have hypertension that have nothing to do with your neuroendocrine disease, but we always have to take this into effect when we're doing a meal plan for you. So remember that those things will also have to be considered. Some of the things that do have to do with you in particular are surgeries that you've had, and if you're having trouble with partial bowel obstructions, because that is something that we always make changes for in patients. First, we want to know if you have normal. How many of you have just normal? You can eat just like you did the day you found out you had your diagnosis. You've not had any problems. So for that group, we're going to go through and we'll tell you, this is just keep eating like you're eating, eat a well-balanced diet. You'll see that as we go through. If you're having digestive problems, nausea and vomiting, we see this many times in patients that have had chemotherapy, and in general oncology, this is one of our biggest side effects and symptoms. In neuroendocrine, we don't have that much. Some people will have trouble, and we'll deal with that, but most times we have diarrhea, steatorrhea, and constipation, and sometimes they just alternate, which ones you're having at the time. Carcinoid syndrome and flushing, y'all are pretty familiar with now. And then hyperglycemia, we talked a little bit about it this morning. When your blood sugars go up, we do have to take that into consideration and plan your meals. And then fatty liver, and I'm from New Orleans area, and so everybody has fatty liver down there because our diet just makes you have fatty liver. I mean, you eat that much of junk. So those things we do worry about. Diarrhea, Dr. Anthony already stole my slide. And so he gave y'all a little bit of a heads up on some of these causes of diarrhea. And we're going to look at this, and if I was talking to you, I would go through and pick out these things that you have or maybe contributing. Short bowel syndrome, if you've had trouble, you've already had your small bowel resected, parts of it taken out, things move through it faster. So the concentration of foods make a difference, and we're going to talk a little bit about that. Things that have fat and sugar move through you much faster, so we reduce those in your diet. Some of the other things that pancreatic insufficiency, if your body's not producing enough pancreatic enzymes, you can't digest fats well, and also some of the proteins and the carbs, but mostly the fat. And we'll have to make an adjustment, or you'll have to have a medication to replace those pancreatic enzymes. So these different types of the other one, drug-induced, somatostatins that we have been just life-changing for this disease also have some side effects. But when we drop these drugs go in, it reduces some of the other things that go on in your body, and one of them is it reduces pancreatic enzyme, and many times you'll get a fatty stool from the medication, but you don't stop the medication, we adjust the diet. So we'll talk a little bit about that as well. But all people in America, so we say, the guidelines say that every diet should be low in fat and sugar, so that it goes the same for patients with neuroendocrine. It's just usually for different reasons. So protein, we find protein's a building block of our bodies, right? So very important that we consume these things, but we try to do it in smaller amounts throughout the day. Large diet, large meals were the one, and there was a study done by Monica Warner way back in the early 90s, and it really gave us a little bit of a guideline on how or where the most symptoms came from with patients, and this was a recall study on just people's diets. And what we found was that large meals caused the most syndrome. So if you ate large meals, you're more likely to get some of the things you might not tolerate. For one thing, you just get too much of it. But we know that if we spread it out throughout the day in smaller amounts, we can get you to consume things and maintain absorption much better. So that's one thing that we do throughout the day. Now, I put in a couple of cancer screening things because some of y'all don't have cancer, but I'm going to throw it out to you anyway. We always hear about red meat being bad. Well, red meat, if it's lean, is not the worst thing in the world if you can digest it. But you increase your cancer risk, colon cancer in particular, if you eat more than 18 ounces a day, and these came out of studies that were pretty reliable, and so we feel that as long as you stay under 18 ounces, and pork is a red meat. It's not really the other white meat. It is considered a red meat. So lamb, beef, and pork are all the red meats that we would consider in this. Poultry, egg substitutes are all fine. Fresh fish is wonderful. Now, fatty fish can be hard to absorb, may cause steatorrhea, and steatorrhea is floaty stools, kind of sometimes foamy at the top, stay around the bowl kind of thing. So steatorrhea is a sign that you're not digesting your fats, and so we either drop the fat down in the content of the food you eat, or we try to get, if your physician will work with you, we'll give you something to help you digest it better. Wild game is fine. We don't talk about that a lot, but in these states of where we are, where we do a lot of cooking, these things are usually lean. Venison's a very lean food. Game bird is also very lean. Quinoa, how many of y'all are familiar with quinoa? pretty popular now. It used to be hard to find. Now it's really easy to find. And it is a soluble fiber, and it is absorbed well, but it's also a total protein, one of the few grains that we have that are total protein. So it works real well to work into these diets. And there are some recipes out there where we've used the quinoa in them. Lentils, soy, nut butters are usually tolerated as long as the fat content isn't too high and you don't consume too much at one time. If you do a peanut butter sandwich and you do a tablespoon of peanut butter and spread it, you'll do fine. If you do, 4 tablespoons, you may not do so well. So some of it is the amounts. But we do know that nuts are hard on the GI tract and they're hard to absorb. So patients that already having diarrhea, these just kind of add insult to injury. So be careful with those, as well as the dried beans. And the ones that we're talking about are usually the red beans, pintos, and black beans. Those are the ones that are hardest to digest because the outside is an insoluble fiber. It's hard to break down. The inside is not so bad. But some of the beans that we don't have so much trouble with are garbanzo beans that are used in to make hummus with. Tolerated pretty well, and in hummus it usually does pretty well as long as they don't put too much fat in it when they're making it, so that's a good product. Seafood is also usually very lean and very usable, and alligator, if you're down in Louisiana, you can use the alligator. It's very lean and it tastes like chicken, right? Everything tastes like chicken. So grains, we know that grains can be very important in our diet to provide in a normal GI tract. We try to get up to 35 grams a day. There's 2 types of fiber. There's insoluble fiber. That's the part that is going to, it's the hard fibrous part of the fruits and vegetables, and the peels on the fruits, those kind of things, skins, and those things are hard to digest, so we don't use as many of those. The inside of the fruits, fruit pectin, is the ones we want you to eat, and they actually help the colon increase its absorption of water. So these things are very good and give you good energy loads. Non-gassy foods are what we're looking for if you just had operation, if you have post-op, or if you having gas problems. There's a diet that was put out for this back in 2010. It's called the FODMAP diet, and you can find it online. Many of the dietitians are using it. And these are just foods that are less gassy. FODMAP, FODMAP. And it's fructooligosaccharides, monosaccharides, and phenols. So that's the short of it. So it's easy to remember it this way. But that can help you get some less gassy foods. And then if you're having trouble with bowel obstructions, your doctors or repeat partial bowel obstructions, the doctor may have put you on a low fiber diet, or if they have, that means it needs to be less than 13 grams so that you'll know. Sometimes we forget to tell you what that really means. 13 grams or less, and usually we want to try to use more soluble than insoluble. Okay, and then quinoa actually is a protein and a carb. Here's some of the other ones. I'm not going to go through it all, but you can see that these are some of the sources that are available, and you can probably find these slides, and I don't know if we're filming today, but to go back and look. If anybody needs to get a copy, if you'll just let me know. I'm very willing to share information. Fruits in some cases can cause your flushing. It's the over-ripening of fruits that develop some of the amino acids that break down, they're usually tyramine, they break down to the tryptophan that actually creates serotonin. Okay, so some of these things can create that. So it's usually when they get soft. I like to talk with my hands, it makes it hard. I got 2 things in them. It's the things that get soft as they ripen are going to cause more flushing. Usually the ones that get the bad rap in this is bananas, and those can do it, and actually avocados, and people like to use avocados, but it says get soft and they can actually cause flushing as well. So you want things to eat fairly ripe. Take the skin off of and the peels, because we talked about the fiber issue, and these can usually be used in small amounts. Now, canned fruits, you need to drain them, take that heavy syrup off, because Dr. Anthony described dumping syndrome to us this morning, and what creates that is concentrations of sugar actually increase that dumping. So we if you've ever been put on one of these diets, they may have told you not to consume very much sugar or sugary foods, and that usually is because it makes it just go out too fast. So make sure that you try to do things that are low in sugar. Fruit juice, you want to dilute it. Again, they're sugary, and so that you want to dilute it. You don't want to get more than 12 grams of sugar at one time. That's where you usually will dump it past that amount. Some of the fruits are high in fiber. Pineapple's one of them. And too much of it, if you just sit and eat it and eat it and eat it. Same thing with watermelon. These things can, and prunes will do this, raisins will do this. They'll actually increase your diarrhea, and they actually can cause some of the risk for obstruction. So be very careful. Although we always hear you need to eat more fruits and vegetables, but just moderate amount. Vegetables, make sure that you chop them very fine. If you're having diarrhea, you're really going to do better to peel them and chop them. I say if you're eating celery, I hate Thanksgiving for patients because it seems like we always have problems with obstructions during Thanksgiving. And sometimes I think as well, it's the foods that just richer. We just cook differently for Thanksgiving. We do the rest of the year, right? We add more special foods, butter and all these things to it. But one of the things we do is get into foods that are a little bit higher in fiber too. And one of those can be celery. We always put that in our dressings, right? So if you're doing that, like peel your celery, chop it very fine, saute it a little bit, clear, so it's a little bit thinner, a little bit easier to chew. That's going to make it a lot easier to tolerate. Avoid some of the foods that we know are hard to digest. Corn is one of those foods, if you've ever fed it to a child, it kind of comes in and out the same way. It's just a hard thing to work with. So these things are going to increase your diarrhea as well. And definitely we worry about it for obstructions. As we already talked about the dried beans. Frozen vegetables are probably the best. Fresh is the best. Frozen are fine. Canned is okay. If you have high blood pressure, then try to get the ones that say no salt added and rinse them. But it's real important you keep things on hand that you can get to. We already talked about one of the biggest problems is fatigue. So I really like you to have, it's nothing wrong with buying the foods already chopped. If you go to the frozen section, the reason I like frozen foods is you can get broccoli already chopped up. And that saves a lot of fatigue. If you're having to chop onions, if you're having to chop all this, it adds a lot of fatigue parts to what you're doing. So it's okay to buy things already partially done as much as you can, and then you're just kind of putting them together. And that's going to really save you not just time, but actually the work involved. And for my husbands that may not have been cooks, this can help you as well. If you can kind of get things that are already done enough, then you can learn to kind of just put things together. It'll help you as you first get started cooking as well, to learn these techniques. If you cook things soft enough or chop them, I say if I now have patients that I have and go back all the way to pureed if the GI tract's not absorbing, because many times, again, we talk about fatigue. You get tired before you finish chewing, and this happens in oncology across the board, and this is no exception. So if you get tired and so you chew 3 times and swallow, those foods don't absorb very well, right? You didn't break them down. Now, we have enough acid in our stomach, we should take care of it, but now many of us are on anti-acid, so your acid's not there either. So those foods don't break down as well, and they may create some of your malabsorption problem. So the more chewing you do, the digestion starts in your mouth. So the best you can do is chew first. If you're not chewing good, chop everything the best you can before you get it down. Cruciferous vegetables, not to be confused with the ones we had at lunch, we don't count those, but cruciferous vegetables can be very gassy, so be very careful with these. They can just be a problem on their own. Onions as well, and if you don't tolerate onions, you might be able to use chives. They give you the same flavoring, and they don't have the gas formation that that onions do, so those can be helpful. Low fat, we already talked about the pancreatic enzymes, which digest fat, may be low, and if they are, then the lower the fat and dairy can help you digest it. Not everybody is milk intolerant. Sometimes it's the fat part, sometimes it's the lactose, but be careful with those. You can use the plain low-fat yogurts. Greek yogurts are very creamy, and these make great sauces. When we think about taking you off of foods, well, you can't have the regular cream anymore in your cooking if you're making a sauce for an Alfredo, right? Or, to put on your pasta. But if you get the yogurt and then flavor it with your seasonings, it will work just as well. And it has some, there's some protein in this as well, so it can be very beneficial. It's just changing those ideas, and but those things can really help. Same thing, low-fat American cheese, if you count it as real cheese, is okay. It's a kind of a processed thing, but main thing is we want it low-fat. But low-fat ricotta and low-fat cottage cheese can be used very, very beneficially because it has some nutritional value, but actually adds a lot to the meals. Probably you've had lasagna. Y'all had lasagna before. The ricotta and the cottage cheese is what's put between the noodles. And although you may not do as well with the tomato, some people won't do as well with tomato. Tomato tends to be one of those items that can trigger flushing. You can still kind of use that same concept and use a different type of sauce with it. We talked about like using the yogurt sauces and just get a little bit more creative with it. You may have even had a vegetable lasagna where they use more white sauce and not the red sauce, and those can help. Try to use low-fat and sugar-free ice cream and sherbets and sorbets, and that is, again, to keep the dumping down. This is if you're having diarrhea, because they just tend to empty out too fast. Fats. The serving size of fats is a teaspoon, and if it's a low-fat item like a light margarine, it's whipped in ice and water, so it's just 1 tablespoon. Avoid deep frying if you can. I mean, that's just something that's not tolerated very well if you're having diarrhea or you're having the little floaty stools, unless you consume a lot of pancreatic enzymes. And if you're taking pancreatic enzymes, if they've ordered you a lower dose, you may have to up your dose. And you can do that. When we're teaching pancreatic enzyme use, we try to give you a way to add up and down a little bit depending on what that meal is. If it's real high in fat, we'll say we'll take, if you're using 25,000 units, for instance, we'll say we'll use 3 with your meal if it's fatty. And then if you come to New Orleans to visit us, you take 4 or 5 when you eat down there. It's a fast little joke, kind of, but it wasn't a joke. I mean, he was a wonderful guy. I had a patient, and he had an insulinoma. And we've heard today it makes your blood sugars drop real low, and it's really a bad thing. And anyway, he had this, and he came down to see us, and he had been getting up all night long. They'd been giving him juice all night long to be able to hold his blood sugars. And he came down to New Orleans, and he ate at one of our local restaurants, and he came the next morning. He was so cute. He was like, I can't believe it. I slept 8 hours because I ate this pasta dish down there, and my blood sugars didn't drop for 8 hours. So that tells you how our food is really rich down there. But these things can also cause a lot of your symptoms, so be careful with that. They really are problematic. There are butter flavor powders. Y'all may have used those before in the food. They add a lot of flavor, and we use them quite often. And when I make recipes, I use them. Not to hit on one or the other, but Molly McButter, Butter Buds. Have you ever heard those? Those are things that can really be used and give a lot of flavor with that in the fat itself. Healthy oils are good. Olive oil is good. Canola oil. But remember, they're still oil, and they're going to still cause steatorrhea. That's not going to change. The one that won't do that is, and I've got it over here, I think, is coconut oil. Coconut oil is absorbed differently, and it can usually be tolerated. MCT oils is one of those, and that we've used it for liver for years. It absorbs differently in the body, and so we can use it as a source of fat. We had to still be careful with it if someone has heart disease, because it is a saturated fat. Although it's kind of gotten a big lift in the media about coconut oil being so good for you, but it's still saturated, and it probably it's going to clog our arteries still, so be careful with it. But it does give us an alternative and especially in this group when we're talking about adding something to foods to give some palatability. Liquids, beverages, we still need the same amount as everybody else, 6 to 8 glasses a day of 6 to 8 ounces. But it's hard to consume 8 ounces and not go straight to the bathroom. So really cut this into 4 ounces at a time, or get one of those containers and just sip. That's what I tell my patients most of the time. Try to do it, we always said 30 minutes before or 30 to 45 minutes afterwards. That reduces the transit time. In other words, it reduces the push it has on the bowels to get things through you. Dilute juices. Dilute sports drinks are usually the ones that have 0 calories in them, because they will also cause the dumping. Decaffeinated caffeine is going to move your bowels. If you just have that one little cup in the morning, I'll let anybody have a cup or two in the morning if you don't mind going to the bathroom. What I can't stop is you going to the bathroom. Okay, that's going to happen anyway. But if you're drinking it all day long, go ahead and go to decaf. That can really cause a hydration problem. Dehydration is one of the biggest problems with fatigue. And I think that we don't recognize it enough. And everybody that's having trouble with fatigue, make sure that you're getting enough fluids. Because being low on fluids and being partially dehydrated, which comes with this disease, if you're having 6 and 8 stools a day, or even 4 or 5, if they're real loose, can cause that fatigue. So make sure that you're consuming fluids throughout the day, because that can really, really make a difference in how you feel. Non-carbonated drinks, if you're having gas or diarrhea, that carbonation is going to contribute to it. Anything that puts pressure on the bowels is going to increase your diarrhea as far as gas. Now, seasoning, there's so many wonderful things to season with. You can use all the natural season that you want. Basil, oregano, rosemary, dill. Chives, we talked about, it's a great replacement for the same onion flavor to use in things. Cinnamon is been used in market to reduce it doesn't solve it, and it's nothing, but it can contribute to reducing hyperglycemia a little bit. We know that plays a little bit of an issue with that, but it's also a wonderful flavor. And nutmeg actually can reduce the transit time. It can reduce the movement of foods through your GI tract, so that has a little bit of natural help there. Gas problems come with onion and garlic. So be careful with those. Both wonderful products, and have a lot of really good things to them. I think that it helps if you saute them down, and some people don't have as much trouble. How many of y'all really know that you have trouble with onion? Did you know? You can tell. You know it. Yeah. If you don't, and you just eat foods and they all have it in there, and you're always having trouble, take it out for a while, and see how much difference it makes. It's amazing. And then if you have syndrome, no hot peppers. If it burns your tongue, it can cause syndrome. Okay, so anything that's real hot, you need to stay away from. Preparation: we want you to bake, broil, braise, saute, grill. But if you're grilling, do it under move it over. Don't do it on direct flames. And again, this is one of those cancer prevention, not specific for neuroendocrine, but just for everybody in wellness. We know that char and the red meats, do contribute to some of the GI tumors. Not neuroendocrine. I'm talking about plain old colon cancer. Avoid raw, and this is real important. Now that PRRT is being done much more often in treatment, we used to not have to worry about this quite as much. But since it's a big part of treatment, if it drops your white count, anytime your white count is low or your immune system is compromised, everything should be cooked. You should not be eating any raw. You should not have salads. You should not have fresh fruits during that period of time until your white counts come back up, because there's no way to kill the bacteria all around. You can wash it. I think it's great to wash it, but you want to kill bacteria. So during the time that your what we would call neutropenia goes on, when your white count goes low, we want to make sure that you're consuming only cooked foods, no raw foods during those periods. It's also very important that you use very good sanitation. So we want to make sure that you wash everything real good. You're going to use separate chopping boards or clean them between raw foods and cooked foods. You never do these together. And there's also a big thing on chicken. They say now you're safer to cook the chicken straight from the wrapper and not rinse it in your sink because of this dispersion of germs around. So, because the temperature is going to kill all those germs that you're washing off. But it's still going to be in your sink, and it can be around the areas. And salmonella is very, very prominent in chickens. That brings up, if you raise chickens and you're using the eggs, it's very important that you wash those eggs very, very well on the outside, because many of them have salmonella on the egg, and they can get in. It's porous, right? So, and I don't know that if you were neutropenic, I would probably not want you to use the yard eggs right during that time. You can buy pasteurized eggs, but I would use just pasteurized during those periods. Always cook it to the proper temperature. Never leave food out over 2 hours. And in y'all's cabin, an hour would probably be my limit. Always heat it back up. Even deli meats need to be heated up past 140. If you buy it at the deli, you need to bring it back to temperature before you consume it, especially if your white counts are down, because this can all cause foodborne illnesses, and you have enough diarrhea without having foodborne illness and really get into complications, because they'll dehydrate you for sure. Alrighty. The foods that are making you have syndrome are usually fermented foods or aged. Those are the processes that increase this tyramine and tyrosine that form to tryptophan, and when your liver's messed up, that conversion doesn't happen correctly. So the serotonin, this flushing happens. These are some of the foods that are commonly in foods, or items that are in foods that are going to contribute to flushing. Some of the reasons probably that, and some of the reasons is probably histamine in them. So, and one of those is MSG. And MSG may not cause flushing syndrome, but it makes you flush, and we can't tell whether it's flushing syndrome from your tumor or whether it's just from the MSG, right? We know that it flushes everybody. But it will cause some issues, so be careful with those. We talked about the aging process. Smoked meats, cured meats, these things can cause syndrome and triggers. Strawberries can cause trigger in some people. Tomatoes cause triggers very commonly. If you have any question, there's books back there by Novartis. Well, I think, there's a book that Lexicon put out that's excellent that I helped with, and these will give you these things so you don't have to memorize them today. Avoid alcohol beverages. Again, it's fermented for the most part, right? So it makes sense that they would cause flushing issues, but we know that you'll flush with alcohol. So meal planning is better off, and since we talked about the caretaker part, this is a real thing to remember when you're doing a caretaking, is grocery shopping is an art. To get through a grocery store timely and look at your labels, it takes a little bit of a pattern. It takes things to add on to. So always make a grocery list and make sure it's things that you can consume. If your body can't tolerate it, if you eat it and you have stool or you have gas behind it, keep your little log, a diary, and then you can recognize, I just don't think I'm tolerating these things, and take them out. But don't buy them and bring them in. If you know you can't eat chocolate, that's a big trigger, right? If you know you can't eat chocolate, don't bring in chocolate chip cookies. I mean, some of it is just don't bring it in the house, right? It's just the same thing we did. My son was an insulin-dependent diabetic, or is still an insulin-dependent diabetic. When he was at home, though, it made no sense for me to buy things that the child couldn't eat, right? So we all ate like he ate. Never hurts you to eat like your patient is eating. It will only hurt you if the patient eats like you're eating. So remember, don't bring it in the house if you cannot consume it. You want to make sure that you store foods, and this is very helpful, especially for anybody that's just like we talked about, fatigue. If you cook a pot of, let's say, a stew, and what I want you to do is go ahead and cool it down and then store it in serving size portions right then. Okay? I don't want you to eat it and then let it sit in the refrigerator for a day and then put it up. That aging process, you may have done fine with it on day 1, but day 2 and day 3, you're having symptoms from it. And it's the aging process, okay? So go ahead and cook and then put it in serving sizes. And then you can have that when you're not feeling good on the days that I just don't feel like cooking. Instead of having order things out that may have the MSG in it, because almost all, do you know where I found the highest level of MSG in foods? Green beans and Kentucky Fried Chicken. All right, so it's not just Asian foods at all. It's in all of them. It's very high in some of them. MSG is a neurotransmitter. It doesn't make taste change a lot. It makes you think things taste better. It also makes you want it more. It also, when you're driving down the road and you've been eating something that has it in it, like Chick-fil-A that I love, when you pass by it, it makes you want to get off the road and go get it. Okay, it's a neurotransmitter. That's how they work. Okay, so try to stay off of them. It'll help with your cravings as well. Mm-hmm. Yeah. All right. So always make sure you don't leave anything over 48 hours. Throw it out. But if you do the store it as you eat it, then you're not going to get in trouble with that. All right. I almost go through these pretty fast. Just make sure you keep things in your pantry that you can consume. These are going to be a few things. I'm going to run through this pretty quick because I've got 5 minutes to get finished, and I want to get on time, keep us on time. But if you're having diarrhea, use a bread that has 3 grams or less. When you look at the label, white bread is the easiest to absorb, right? That's what makes our blood sugars go up. It absorbs very fast. But you can use fiber. You can use brown bread, as we call it. You can use some whole grain breads, but not the one that has 9 seeds in it. I don't want to see the grains in it. I want it to be, where it doesn't have nuts and seeds are visible. About 3 grams on the package, okay? Powdered milk can be used. It has a lot of protein in it. We sell it in a lot of different forms to increase your protein after surgeries, but powdered milk works great. When you're meal planning, it's the wrong way. Carbohydrates, instant potatoes are a great thickener if you're trying to make sauces. We talked about that being a problem. Potato thickens very well, and it's a good flavor. Soluble grains, and is a soluble grain. And then cereals, keep cereals that you can eat, that you like. Rice Krispies are pretty good. They're easy to absorb. Rice is very easy to absorb. I know I'm down south. We eat it a lot more than we do in other areas of the country, but it actually is very, very tolerated easily for people that are having trouble, especially after surgeries. Potatoes are very important as well. Don't eat the skins on them. Cooking oils are, we kind of talked about the heart healthy thing, and that's wonderful. I think we ought to stay in that track. The medical oils, the MCT is what we were talking about. We talked about that being a coconut oil, not an oil. I don't know. And then butter, and then olive oil is okay, and but they all have the same amount of calories, and they all can cause, except for the coconut oil, probably can cause a little bit of diarrhea. Don't go hungry if you go to the grocery store. Take a list. Read your labels. Replace your staple pantry items. When you mess up, if you know today what you're going to eat tomorrow, you're going to do fine. If you wait tomorrow at lunch when you're hungry to make a decision, you're going to eat the wrong thing. And then you're going to feel bad the rest of the day, and maybe the next day. So keep your pantry with foods that you can consume and do well. Cream potatoes, cream of wheat, oatmeal, blend it down well. We do grits in the South. These things are really good to keep in the pantry. Some canned tuna packed in water. Something that you can get to, that you can make a meal from without having to go to the grocery store. Small, frequent feedings do best. Eat from a rainbow. I can come up with a rainbow. Everybody says everything you serve is white. No, I can come up with a rainbow. Beets are wonderful, and they're great color, right? And they're tolerated really well. If the doctor has ordered you medications to take when you eat, take them. One of the biggest problems we have with the medications that we have on the market that are really good is getting you to consume them. If you have to take your medicines as ordered, waiting to take them aren't going to help. If you're on pancreatic enzymes, you need to take it before you eat. If you wait and an hour after you eat, it's not going to do you any good. It has to be there for it to work. Same thing with these other medicines that you're being ordered. So that, especially if they involve with this tryptophan, they have to be taken as ordered. If you're dining out, look at the menus before you go. Most places have that available for you. Don't use cream sauces. Pureed vegetables can do a great thing to add sauces. So I can puree beets and put it underneath a steak, and it makes a great sauce for that. And it's also very pretty, and it gives you moisture. So they'll have those things. If you tell the restaurant that you have trouble or these restrictions, most people are very accommodating. They'll come up with something that you can do. Just give them time. Check with them a day before. Tartar's raw, no raw oysters, nothing raw. I'm not going to go through that. Okay, so just like we said before, just like the zebras have different stripes, everybody living with neuroendocrines are a little bit different. Dietitians such as myself that have worked with this for quite some time, I can usually tell your symptoms and what's going on, and I can develop a meal plan. I can help you with it. I don't work in practice as much. I actually retired 1.5 years ago from neuroendocrine clinic. but I often get calls. If someone needs me, they'll find me, and I'm probably going to go back in the world of telemedicine, and I get pulled back in by some of my doctor friends that know that what I'm doing is important, and there's not enough dietitians that know about what's going on and to be able to help. So as telemedicine grows, and I guess we're about there, and I can reach out, then I'll try to get more in touch with residents and patients. Yeah, I take care of patients in nursing homes now, so everything's a resident, not a patient. So I apologize for using those. But be glad to help anybody that's in a support group and you know somebody's having trouble, reach out to me. I don't mind at all, actually, but no, I really do want to help, and that's really my job. All right, I want to thank y'all for having me today. It was a great honor.